In this video, I want to help you understand the difference between acute traumatic injuries and chronic overuse injuries in BJJ and explain why knowing the difference is key to getting the best long-term solution for your injury. So just a quick story to illustrate the point. I was training a little while ago and one of the guys kind of rolled a bit funny and broke his finger. It kind of got quite deformed, a bit out of whack. Now, of course, it was all very dramatic. Everyone stopped to check he was okay. We debated whether or not he needed to go to the emergency room, A&E as we call it here in the UK. And eventually he got it looked at and it was, just a very simple fracture. They splinted it up and he's already back rolling with the splint on. Now, contrast this with another story. I was rolling in class with one of the higher belts who I think I have quite a good relationship with, and he asked if I could avoid any attacks on his left shoulder because his shoulder was playing up again. Now, this guy has been rolling with left shoulder issues now for years. It often puts him out of action. He's often in quite a lot of pain. However, unlike the broken finger, nobody bats an eyelid about this type of injury. Nobody checks to see if he's okay or suggests he do something about it. It's just considered an inevitable and normal part of doing Brazilian Jiu-Jitsu. Now, I use these contrasting stories to illustrate a really common but quite significant mistake I see a lot of guys who do BJJ make, which is treating acute traumatic injuries like the broken finger really, really seriously, but largely ignoring long-standing chronic overuse type injuries like the shoulder problem. So just to be clear, in clinic, I tend to break injuries down into two really broad categories. So the first type is acute traumatic type injuries. So these are those that occur suddenly and are usually the result of a specific incident or impact. So obvious examples of this are things like falling off your bike and breaking your wrist, stepping off a curb and twisting your ankle, getting kicked in the side and breaking your ribs. Injuries with a clear, obvious traumatic cause. On the other hand, chronic overuse injuries are injuries that develop gradually over time due to repetitive stress or strain on a particular part of the body. So clinically, these will be things like a tendinopathy, bursitis, stress fractures, joint irritation. They are normally due to some sort of inherent problem in the body. That might be movement dysfunction, muscular imbalance, maybe a postural issue, something like that, that then breaks down over time and causes injury to the body. So you're probably asking, so what? Why does this matter? In my opinion, it matters quite a lot because traumatic injuries force you to take notice. They can be quite a shock. They can be acutely quite painful. You didn't have an injury 30 seconds ago and now you've got one. Because of this, most acute traumatic type injuries are managed really well and consequently heal with no negative consequences. It's very possible to break your arm, and if you manage it properly, as most people do, it's never an issue again. Now let's contrast that with how, let's be honest, most BJJ guys treat that niggle in their neck, that pain in the shoulder, that irritation in the elbow that just started a few months ago and has got progressively worse. You should probably do something about it, but I'll just train today and see how it goes. The problem is, because these chronic overuse type injuries are normally due to some dysfunction in the way your body is operating, not only do they not tend to get better, but they do tend to get worse over time. And importantly, these are the type of injuries that tend to become really shitty, lifelong injuries. We all know that person who always has a sore shoulder, always has a bad back, always has a hurt knee. Maybe that person is you, which is why you're watching this video. What I'm telling you is that there is a better way to manage these things, and it starts with properly identifying whether or not you have an injury that is acute and traumatic or a chronic overuse type injury. So my advice here is when you feel something is off, take those niggles seriously. Now, you don't have to wrap yourself in cotton wool and take 6 weeks off every time you get a sore elbow. However, in my experience, most guys who train, who do BJJ, know what their constant niggles and nagging injuries are. If you address it and learn to manage it properly before it becomes too much of a debilitating issue, the treatment and maintenance you will need will likely be relatively simple and effective. On the other hand, if you leave it too long, like we so often do, that niggle can become a chronic lifetime injury that could have been avoided. And in my opinion, that's quite a shame. I hope you found that information useful. If you are suffering from an injury and want some advice on how to tell whether it's an acute traumatic type injury or a chronic overuse type injury, you can watch my video on that topic. If you have any questions or perhaps suggestions for future videos, please leave them in the comments below. I'm here to help you train harder for longer and, importantly, as pain-free as possible.